Okay, so here is your lecture on exercise behavior and adherence. Very important topic when we're considering the behaviors of people when it is related to physical activity and or sedentary behavior. We've looked at some of the facts already. According to healthypeople.gov in 2020, you can see the fact there. So of course we're not talking about nutrition in this class, but I do like to circle around and always let you know that I'm aware. It is also an incredibly important piece of this puzzle. But for our purposes as kinesiologists, this is our area. We see that only about 20% of the population is getting enough physical activity, that being the 150 minutes a week minimum of moderate or 75 minutes of vigorous activity, and the 2 days of strengthening exercises per week. We understand that we're having a health crisis in many ways, and so we're seeing this huge increase in obesity, and we also have alarming rates of chronic illnesses that are very disruptive to personal lives, family lives, and also economics. And these are some of the obesity-related conditions. Remember that we can't say that this causes that. We can't say that this or that is proven. We are talking about relationships. We can't go in and watch the cellular mechanisms of a person across their lifetime. The one person who eats cupcakes all day and another person who eats a balanced, healthy diet, and see what happens to their cellular changes. So all we can do is look at somebody's behaviors and their conditions and see if there's any sort of relationship that can be also eliminated from other people. And if there are enough people that have this relationship, then we have something to talk about. And that is why we do have to perform multiple research projects in order to provide best practice guidelines for care providers, people who are looking for information through science, if perhaps they have some questions about a particular disease or illness. We want to make sure that we're not just providing onesies, twosies in the ways of research. We really need to find these patterns that can be verified again and again. All right. Here's some information. I'm not going to ask you to memorize these statistics, but I would like for you to take a look at them. This is a report from healthypeople.gov, and so you can see that people who get at least 150 minutes look at 43.5%, and the target for healthy people, which is to increase these measures every decade, their target is 47.9%. We see that here's the 300-minute a week mark down below, and you see the numbers there. 28.4% are doing it. The target is 31.3%. So you can see they're only looking for a 10% improvement. And I want you to pay attention to this, because when you're trying to move behaviors in a population, yeah, of course, you'd like for everybody to just start doing it. But is that practical? It's probably not. If you can get 10% per decade, well, then you do create something that is long-lasting. It's sort of like the idea with weight loss. You've heard your entire academic career that weight loss should be slow and steady. Well, changing behaviors for weight loss are very similar to changing behaviors for physical activity. And if we can get a 10% improvement per decade, that's a huge decrease on the burden to individuals, families, and to economics. Here are people who meet the objectives for aerobics and for muscle strengthening activity, and here's where around 20%, a little less than 20% number comes in. And then adolescents currently meeting the activity guidelines for aerobic and muscle strengthening. Really we're pretty low here, so 20%, that's not good. These are lifelong patterns. So it's definitely not too soon to start addressing this, because these adolescents in 10 or 20 years will be the young adults, and you guys will be older. So we don't want these people to be sickly and weak. We want them to be healthy and strong like bull and also very smart, right? We want society to keep moving forward. And if people are sick or fighting a lot of health issues, it's going to cost us all. All right. Elementary schools require daily PE, only 4.2%, or pardon me, 3.8%. So I don't know. I don't really recall having daily PE, but that sure would be great. I think it's a great idea. Then senior high certainly a lot fewer. Uh, but in truth, PE has been reduced in all of the schools, and this is something that's been going on over the last decade. And the idea is if we give them more time in the seats, that they will do better on their standardized testing. Well, that has been an abysmal failure, and there fortunately is a trend now to start bringing PE back. I will take this moment to tell you that currently in the state of Nevada, they don't get too much recess, and PE is at a minimum. So in some schools, it is my understanding that recess is now something like 10 or 20 minutes before lunch. And no regular recess like I remember having. That provides an awful lot of opportunity for kids to get busy and active, and so, well, you guys watch the Spark video. So I will tell you, though, that UNLV is preparing to launch a PE educator program in the education department. It used to be us in kinesiology that trained PE teachers, but that program is being designed. Of course, until it's up, you can't, register for it or count on it. But my understanding is that it's under development and nearing completion, so that's good. And the reason being that we are actually short of PE teachers in Clark County. So they've brought enough PE back, and there are job opportunities in that direction coming up. Okay, so pay attention to these facts. Go through your slides. Take a look at the demographic data. I'm not going to read the slides to you. So we see that there are, women tend to be less active than men. We see certain genders, certain groups, certain ethnicities, and ages, etc. So take a look. Be familiar with that material. And here's the idea that we like to address as well in our class. Of those who start exercising, half of them are going to drop out in 6 months. That's your statistic. It's actually a little better than I would guess, but still, here we are. All right, so we want to exercise to control our weight, reduce these elements of chronic illness, because it's enjoyable and it makes us feel good about ourselves. And one of the great reasons to exercise is really that idea of socializing. For some people, that may be the only opportunity they have to do something social in today's busy lifestyle. So that also has some wonderful effect on psychology. All right, so we'd like to see that we include elements of proper nutrition. Weight loss should be slow and steady. As people with a Bachelor of Science, you can cite both the physiological and psychological benefits of exercise. And this is why I'm asking you to learn material from peer-reviewed, published research, because that is where you go. That's where you go to find out. You're going to see a lot of misinformation on the internet. A lot. There's probably more misinformation or wrong information on the internet than there is appropriate information. So if you just expect to be able to go to the internet to type something in about a particular supplement or a workout program, something to do with muscle tissue, you will be sometimes misled or confused. So it's a good idea to be able to cite the peer-reviewed research, the evidence-based practice. Evidence-based practice. And of course, we want to help people to get started and maintain. Sometimes it's a challenge, one way or the other. For some people, it's more a challenge to get started. Some people, it's more of a challenge to maintain. So that's my usual excuse. And you notice it says perceived lack of time. Often somebody might be a little more honest and say they have a lack of energy, which is really funny because working out gives you energy. So it is one of those mysteries of life, isn't it? I have said that too. Really what it comes down to is probably a lack of motivation. Priorities are what we do, not what we say. We can tell what a person's priorities are by what they do every day. So if it's constantly saying, oh, I need to work out, but spending more time in a different activity, then the priorities are obviously with that other activity. So a person I'm aware, I could maybe go to bed a little earlier, and even if not, get up a little earlier and make time to do, some type of additional workout. We all know that. So life is busy. Everybody's busy. Maybe you don't have time. I don't have time for, 3 or 4 hours of yoga a day any longer. I used to. I do sort of miss those days, but I don't have it. But there's still a way to fit in physical activity to my day. So we have to look at our reasoning behind this stated lack of time. You're going to hear that, though, all the time. That's what you're going to hear. If you roll your eyes, then you've lost your client. So be prepared and understand that then it's a way of helping them to realize that maybe they can free up some time. Because they genuinely do, like you do. You feel like you're busy. If somebody tells you, oh, come on, make some more time, you want to punch them, right? Well, your clients will feel the same way. So better to learn now how to deal with that perception. All right, so you should be able to highlight the benefits of exercise and again, provide that evidence-based practice to your clients so that they have been given the most up-to-date information. Most of the time we say it's time, but it's mostly about priorities. And it depends on the person. It's all very individualized. I would suggest that you consider having an intake form that asks some specific questions of your clients, regardless of what type of care provider you are. Whether you're a fitness provider or a physician, ask some questions that will allow you to understand a little bit about that individual's perception of activity, their relationship with activity, and without a judgment, this gives you information. So you'll see that it's all very individualized, that people of different ages or genders cite different reasons for not exercising. Of course, sometimes people have health issues, and for those of you going into physical therapy, you're going to be working with injured people. So take a moment and understand these aren't people just coming to you because they want to, build 3 pounds of muscle this quarter or whatever it is. They are hurting. Often they have been in accidents or had life-changing surgeries. They don't feel good. They probably are on medication. Some of these people may not have ever worked out beyond school and PE, maybe since college. And so here you are now trying to motivate them to do their rehab. And if you've been through physical therapy, a lot of times that type of activity is not very much fun. It's not like going to a Zumba class. It's not like going to CrossFit. It's tedious, it's not fun, and it has to also be done at home. In many cases, in order for the program to be successful. These are all things that you have to take into consideration. Somebody may be on chemotherapy, and you are charged with helping them to perform certain types of movements. You also may be working with a population who has some type of psychological barrier, or maybe a learning disability. Very powerful work can be done in Alzheimer's homes, which there are now more than you might imagine. And if statistics are accurate, this is a population that many of you will be working with in your future careers. Sometimes the reasoning is about inconvenience, and it's easy for us to say, oh, well, but again, that's priorities. And that's true, because you don't really have to have a gym. You don't have to have a lot of expensive equipment to work out, right? You can do push-ups. You can do, dips on your coffee table. You can walk in some cases, but then can you? In some neighborhoods, it's not really safe to walk outside. Maybe a person lives in a very tight space with a lot of other people. So again, you have to individualize this. Now, there's always a way to get creative if a person is motivated enough. And so you might try to figure out ways to help a person include more activity into their life in a practical way, in a cost-effective way. Going to the gym is not the only way, right? And for some of these folks, it's just basic moderate movement or rehabilitative exercises. It's not necessarily a fancy workout that needs a lot of equipment, right? And I'm not a huge fan of going to the gym. I used to like to go to the gym. I don't like it so much anymore. Another question you might ask on your intake form is if a person likes the gym. Now, I will tell you, it's very challenging to change a behavior. If it feels really awful over an extended period of time, there's very little chance that a person is going to stay with that change. Of course, everything feels uncomfortable in the beginning when it's new. But if it's something that a person truly dislikes, then the adherence rate is going to be much lower. So ask what a person thinks about this environment or that environment. I think it really a lot comes down for me individually. I think if we're really getting down to the root of what's behind the attitude, sometimes you have to look at not the words of the attitude, but what's behind that. And that could be, in this case, a lack of motivation and, maybe of energy. When you don't feel good, you don't feel like exercising, and it's kind of insidious. I have a client who recently went through some health challenges and took a very long time to figure out what was going on. And towards the end of that, he had a very difficult time making himself do the things that he knew he needed to do to stay level. And sometimes was successful and sometimes he wasn't. And once he began to eradicate the health issue, he suddenly wanted to work out more. And it wasn't necessarily a change in his attitude as much as it was his system wasn't operating at full potential. And so it was a challenge for him to feel his normal level of motivation. So these are also things to remember. Sometimes motivation also has a general health component. So it's just something to keep in mind. So these are all things, if people come to you or you have been assigned to a patient, it is your job and responsibility to take all of these things into consideration and not just tell them what exercises to do and how to do them safely. You really must take into consideration their psychological readiness to exercise, as well as any underlying health issues, their preconceived notions, maybe their priming, maybe their environment. So many things to consider in order to be a maximally successful care provider. Some of the other barriers to physical activity for some people is this lack of social support. One of the things as a care provider that you might be able to supply would be an exercise partner. Now, if you're teaching group fitness classes, of course, that's built in. However, if you have a physical therapy office, this is often where you can schedule people to do their rehab at the same time that are maybe doing the same type of rehabilitation or have something else in common. You also could bring in interns from the local college. And this is an opportunity for pre-PT students to come in and you can instruct them some basic things. They can be a workout buddy. Social support is very important. And if a person does not have support from their spouse, which might seem counterintuitive, but does often happen, then this is something that maybe you can successfully provide in a way that is not inappropriate. So, what I mean is, it's not your job to get in and be somebody's best friend and ask a bunch of questions about their marriage. That's probably not a good idea. But you can certainly pick up on cues. Oftentimes, patients and clients will just tell you things, often more than you'd really like to know. And this might give you some insight as to what they are dealing with as far as barriers at home. Particularly in a case where a person has some type of mate or roommate or friend that they spend a lot of time with, and they share a relatively sedentary lifestyle. When that person is either forced to because of for health reasons or chooses to for self-betterment reasons become active, the person on the other side is often felt like their life is changing outside of their control. And it depends on that individual and certainly other circumstances as to how they might respond. So you might even find in some situations that not only is there a lack of support, but sometimes there is a deliberate drive to stop the physical activity, which sounds really crazy, but it does happen. And I'm not encouraging you to get involved in the middle of their business. In fact, I suggest that you do not. Unless you do take on a certification or a licensure for counseling or marriage and family counseling, then I might suggest that you have people to refer your patients to that you trust and respect, and just have some business cards ready. Be sure to stay within your scope, but be aware that these factors do influence a person's willingness to stay with their program. Lack of time and money. Well, we think we've addressed that in prior slides. Here's the figure showing 50% will drop out. All right. So this is one of your goals as an exercise professional, as an exercise science professional in whatever field you go into. Also important to help people to develop a contingency plan. Things do happen in life, and so in any type of fitness prescription, exercise prescription, rehabilitation prescription, there has to be this discussion. Otherwise, when people do, for whatever reason, fall off the wagon, if you will, they have a plan to get back on without a lot of undue drama. So one of the reasons that we have to stop and have this conversation is not because you haven't been encouraged to learn in your coursework how to write an exercise prescription, and it's something you'll probably continue, and maybe you're in the beginning of your kinesiology education. You'll be getting a lot of this information, all very good information, and you do need these basics. You need to have this basic understanding, but unfortunately sometimes we see things as a one-size-fits-all, and again, an exercise prescription simply can't be one-size-fits-all. Even for the same aged person with the same injury, there are many, many aspects to take into consideration. So one of the problems with exercise prescriptions is that they are too restrictive. They do not take people as a whole into consideration. And so when we're looking at motivation, which we're moving into, how do we help to stimulate motivation? How do we enhance motivation? We will see that an exercise prescription that is overly restrictive, does not allow autonomy, does not allow a feeling of success, is probably not going to be a good motivator. Sometimes it can be too challenging for people, beginners. I know that sounds ridiculous to you because the majority of you are athletic. However, think of your population. That's my cat. I'm not going to stop. My mother is in her late 70s. When she was growing up, women were not asked to exercise. It wasn't really what women did. They played tennis. Sometimes they were, in college. They swam. But she'd never worked out. And it just wasn't a thing. Well, you guys watched the video. That's what I'm saying. In the 70s, my mom was in her 20s, 30s. So women weren't encouraged to be active. So if I'll just tell you this because with the population aging, their adult population aging, as a physical therapist or care provider in that way, you'll be working with a lot of older adults, people that are older than you. And one of the things to remember is that they had a different background related to exercise. Maybe somebody was a college athlete, whether male or female. Older adult, more likely male, not always. Um, and then they haven't worked out since. But in their mind, the only way to work out is what they used to do to train athletically. Of course, you have to help them define a new normal. So be careful of thinking that it's just easy. Maybe for some individual, it's not. It's hard to know what it feels like to be in someone's skin if they have a kidney problem, if they have diabetes, if they have recovered from cancer or heart attack. So it's always a good idea, particularly when working with a population that has been compromised, to err on the side of being moderate. You can always increase the intensity, but it's important for people to feel that they can be successful. In order to promote self-responsibility, you have to empower people. Punishment only will take you so far, and we'll talk about punishment in a later lecture. Punishment won't necessarily be motivating for the long term, particularly when it comes to self-care. So we will look at this information on motivation in the next couple of weeks, and I will encourage you to pay attention. This, I think, is one of the more valuable tools that are given to you in this course. So we'd like to include elements of motivation that help to promote self-responsibility and self-empowerment. Expect and plan for relapses. If somebody's going on vacation, you can help them figure out what they're going to do, or maybe just give themselves permission to take a vacation with some additional walking. But whatever it is, plan ahead. Imagery can be helpful, relaxation, time management. It's very easy to learn some breathing techniques, some relaxation techniques, and certainly might be helpful tools for you. Being able to guide people through meditations is an incredibly valuable tool for me. As I said, it can be quite simple to learn if you're willing and take the time. Lots of additional tools that will help you in your career path. Very famous psychologist says that should is shit. We want to replace our shoulds. Quit shoulding on yourself. Don't should on your clients. The next time you say should, try a different word. Could. Want to. Instead of you should do this, say you could do this. There's an entirely different connotation. The other term is try. Trying is lying. What happens? Sort of an aside. What happens when somebody says, "Hey, you want to go to my party?" And you go, "I'll try." What does that mean? It means I will not be there. So replace shoulds. Pay attention to the use of that word. Positive self-talk is helpful. We talk to ourselves 60 to 70% of the day. No, you're not crazy. You are human. 60 to 70% of the words we hear in our head come from us, either in our head or even sometimes spoken out loud. Therefore, I ask you to consider what would happen if you were in a room where 60 to 70% of the day somebody was berating you, telling you weren't good enough, telling you that you couldn't get it done, telling you that people didn't like you. How would you feel? All right, so this is the type of self-talk that you regularly expose yourself to, whether that just be out of habit or unawareness, then, well, something to consider. At any rate, positive self-talk can be very helpful. So pay attention to your self-talk, and then just see if here and there you can alter it. Teach that to your clients. Identify situations that put you at risk. So if you can't avoid them, then you have to create a plan. If you can't avoid them, avoid them. When I first started, when I first quit drinking, the only job skill I had was working in a bar, and I had children. So there you have it. I had to work in a bar. Was it ideal? No, but I had a plan and a strategy. So I tell you, it can be done. Um, if a person is surrounded by an environment that is not supportive to their exercise, there's still a way. You just have to develop a plan, and maybe that's what you can help them to do. If there's a temporary relapse, it is part of life. Just start over. That's the message. Spousal support. You can involve the spouses in orientation sessions. Depending on the spouse and depending on how you set it up, you might also involve them in the routines, the rehabilitation. Now, be careful with this. If you sense that the spouse is then going to use that as a, as some power, if it is not empowering to your client, do not involve the spouse in the workouts. This could just make it more challenging for your client. So this is where you're just going to have to use your intuition. But you certainly can involve them in ways that help them to feel like they aren't shut out. I'm just going to use this example, and certainly different genders or situations or ages could apply. Let's take Mary and Bob. Mary and Bob are 68. They got married when they were 19. Mary and Bob, over the last 20 years, after their kids were raised, developed a routine where Bob came home from work, she had dinner, they sat in front of the TV, they ate their dinner on TV trays. She knitted, he read, they went to bed, and got up and went about the next day. Suddenly, Mary enjoys Zumba and is not home on Monday and Wednesday nights. Or, far worse, Mary has a car accident and now has to go to physical therapy several times a week and has to do exercises at home and is being encouraged to start walking in order to bring down her cholesterol and high blood pressure and improve her body composition. Well, her husband, I think his name is Bob, pretty sure it was Bob, he's not having this. He has a lifestyle, he's enjoying it. He comes home, she has dinner ready. They sit in front of the TV. There's been a change he hasn't agreed to. Now, of course, he's a thinking, caring human being. He's glad his wife survived the accident and that she's on a path to recovery. But the rest of this seems to be far-fetched, not within his contract. This may be what you are facing. Be aware of it. And so this is where maybe involving Bob in the orientation, explaining to him some of the underlying processes if Bob fancies himself to be someone who is a fan of anatomy and physiology. Look for ways to involve the spouse, but make sure it's practical and make sure it is empowering to your client and not the opposite. Early patterns are formed early. So we would like to get kids active early. We would like to reduce obesity in children because obese children become obese adults, and that's where we really begin to see the health problems and the depression and all of the other comorbidities associated with obesity. Believe it or not, they find that where exercise adherence is concerned, that moderate levels are better. Apparently, moderate levels produce more adherence. So in a group that might statistically have a low level of adherence, you might keep it moderate. Of course, this is individual. It depends on who you're working with and what their goals are. Group exercising tends to produce better adherence, maybe the social aspect. There it is, support from family and friends. We keep coming back to that. Very important in adherence. Helping a person figure out the best time. If they're a morning person, they like to work out in the morning, do that. If they would like to work out at night, have them do that. Just because you like to, or maybe the science says this or that, help a person find the right fit for them, and that's going to produce a higher level of adherence. You as an exercise leader need to do lots of things. So it isn't just about knowing the safe and practical way to do these exercises. You also really need to know how to give feedback, help them to set goals. You need to be concerned for their psychological comfort as well as to promote some type of long-term plan that gets this job done. It's important for there to be a specific plan in place. So your SMART goals, go back to your SMART goals. You're specific, measurable, action-oriented, realistic, and time-stamped. There is a time involved. SMART goals can be very effective when you're designing an exercise prescription for an individual. And remember that location is important. All right. Okay, you can watch the rest of this lecture on the next section of the video.